For decades, we've been told that cholesterol is the enemy. But what if cholesterol was never the real problem? The truth is, cholesterol is a repair molecule. It only becomes dangerous in the presence of inflammation, insulin resistance, oxidative stress, and metabolic dysfunction. In this video, I'm going to show you the real root causes of high cholesterol and cardiovascular disease, why lowering cholesterol alone often fails, and what functional medicine teaches us about healing the body from the inside out. We'll talk about insulin resistance, liver and bile function, thyroid health, inflammation, and why oxidized LDL, not total cholesterol, is what truly drives heart disease. If you're tired of temporary fixes and want to understand why your cholesterol is high and how to address it at the root, you're in the right place. Let's get started. Hello and welcome. My name is Dr. Maggie Offoha. I'm a doctor of functional medicine, a former clinical ICU nurse, and a health educator passionate about helping people understand the root causes of disease, not just the symptoms. On this channel, I break down complex medical topics like cholesterol, inflammation, hormones, and metabolic health in a way that's clear, practical, and empowering. My goal is to help you move beyond quick fixes and medications alone, and instead, understand how your body truly works, so you can make informed, life-changing health decisions. If you're ready to learn how functional medicine approaches healing from the inside out, you're in the right place. Disclaimer: the information shared on this channel is for educational and informational purposes only, and is not intended as medical advice, diagnosis, or treatment. I am not providing medical care through this platform. Always consult your physician or a qualified healthcare provider before making any changes to your diet, supplements, medications, or treatment plan. Never disregard professional medical advice or delay seeking care because of something you have watched or read on this channel. Functional medicine approaches discussed here are meant to support overall wellness and do not replace conventional medical care. Lipid panel and cardiovascular risk. Lipid patterns offer insights that extend beyond mere cardiovascular risk. In functional medicine, the lipid panel serves as a reflection of systemic metabolism, inflammation levels, hormonal signaling, insulin sensitivity, liver functionality, and detoxification abilities. Instead of looking at lipid values independently, functional assessment focuses on patterns, ratios, and contextual factors. This approach enables the early detection of metabolic dysfunction long before any diseases manifest. While conventional medicine typically prioritizes lowering cholesterol, especially LDL, functional medicine seeks to understand the reasons behind lipid abnormalities and the underlying issues driving them. Often, lipid dysregulation is a secondary consequence of insulin resistance, chronic inflammation, dysfunctional thyroid levels, oxidative stress, or compromised liver and bile functions. 1. Core laboratory markers. The standard lipid panel reveals much more when assessed using functional ranges instead of broad population reference values. Marker functional range and functional interpretation. Total cholesterol 160 200 mg DL. Too low may signify malnutrition, impaired hormone production, or liver dysfunction. Elevated levels often suggest inflammation, insulin resistance, or ineffective lipid clearance. HDL and GT 60 to mg DL offers protection and reduces inflammation. Levels below 45 mg DL indicate oxidative stress, insulin resistance, or inadequate reverse cholesterol transport. LDL 70 to 120 mg DL. Higher levels may point to thyroid issues, inflammation, or oxidative stress, rather than excessive dietary fat. Triglycerides 60 to 100 mg DL. Elevated levels are often linked to insulin resistance, high carbohydrate consumption, and fat accumulation in the liver. TG, or HDL, ratio, and LT 2.0, considered one of the strongest indicators of insulin resistance and cardiovascular risk. Functional insight: LDL cholesterol alone is a poor indicator of cardiovascular risk. A focus on triglycerides, HDL, and their ratios provides a clearer picture of metabolic health. Functional lipid patterns. Lipid panels often exhibit patterns rather than isolated issues, with each pattern suggesting distinct root causes. Pattern. Typical labs. Functional clue. Insulin-resistant pattern triglycerides. HDL. Indicates metabolic inflammation, insulin resistance in the liver, and excessive refined carbohydrate consumption. Hypothyroid pattern. LDL. Triglycerides normal. Shows reduced conversion of thyroid hormones, T4, T3, and ineffective LDL clearance. Inflammatory pattern. LDL, HSCRP. Implies endothelial damage, oxidative stress, and chronic inflammation. Low cholesterol pattern. Total cholesterol 150 mg/dl. Signals malabsorption, inadequate bile, liver dysfunction, or insufficient dietary intake. Clinical pearl. Patients with normal LDL levels, but high triglycerides, and low HDL may be at greater cardiovascular risk than those with elevated LDL alone. 3. Lipids, inflammation, and cardiovascular risk. Cholesterol is not inherently detrimental. It plays a crucial role in maintaining cell membrane integrity, producing steroid hormones, synthesizing vitamin D, creating bile acids. The actual contributor to cardiovascular disease is the oxidative modification of lipoproteins amid inflammation. When LDL particles oxidize, they instigate immune activation and endothelial harm, facilitating the formation of atherosclerotic plaques. Therefore, inflammation, insulin resistance, and oxidative stress, not cholesterol itself, should be the main focus in functional cardiovascular care. 4. Functional support strategies, nutritional and supplemental support interventions. Omega-3 fatty acids, EPA, DHA, 2,000–3,000 mg/day, help reduce triglycerides, lower inflammation, and enhance endothelial health. CoQ10, 100–200 mg/day, supports mitochondrial function and protects against depletion caused by statins. Dietary fiber, 25–35 mg/day, aids in bile excretion, lowers LDL levels, and boosts insulin sensitivity. Antioxidants, vitamin C, E, selenium, help minimize LDL oxidation and vascular inflammation. Polyphenol-rich foods, berries, olive oil, green tea, enhance lipid particle quality and diminish oxidative stress. Addressing root causes, normalizing lipids effectively involves tackling the primary drivers, insulin resistance. Maintain blood sugar levels and diminish triglyceride production. Thyroid dysfunction. Ensure optimal T3 levels for effective lipid processing. Liver and bile function. Promote detoxification and cholesterol recycling. Inflammation. Decrease dietary, environmental, and metabolic triggers of inflammation. Functional medicine. Insight. It's not cholesterol that's harmful, but rather the dysfunction that needs to be addressed. Lipid patterns serve as adaptive responses to metabolic stress, inflammation, and hormonal imbalances. By tackling underlying causes, lipid levels frequently normalize without intense pharmaceutical measures. Cholesterol becomes a problem only when the body is inflamed, insulin resistant, oxidatively stressed, or unable to properly clear and recycle lipids. True cardiovascular healing doesn't begin with chasing cholesterol numbers. It begins by addressing the root causes: blood sugar imbalance, chronic inflammation, liver and bile dysfunction, thyroid health, oxidative stress, and lifestyle factors. When you support the body at the root level, cholesterol often normalizes as a result, not a target. My hope is that this information empowers you to ask better questions, seek deeper answers, and take an active role in your health journey. If you found this helpful, please like this video, subscribe to the channel, and share it with someone who's been told they have high cholesterol but still doesn't have clarity. Thank you for watching, and I'll see you in the next video.